Good morning everyone, I'm Dr. Fatima Munshi and the title of my presentation is The Best Way to Disguise as the Great Mask Blinder. A 30-year-old female came to ophthalmology OPD with chief complaints of diminution of vision in both eyes since 3 years, which was gradual in onset, progressive and painless in nature. There was no history of similar episodes in the past, no history of spectacle usage, no presentation in sibling, no history of trauma, redness of eye, photophobia, floaters or flashes of light. There was no history of recent surgery or any radiation exposure or anemia. There was no waxing and waning of the visual symptoms. There was no history of tuberculosis or contact TB or any lesions around the eye. No history of drug intake or any other systemic illness. She visited to a different ophthalmologist 10 days back with similar complaints. Her fundus findings recorded were diffuse pigmentary changes with subretinal edema both eyes, which was left more than right. She was advised CBC with ESR, chest X-ray, MON2, ANA, RA factor and serum ACE levels. She was started on ATT after positive MON2 test with a diagnosis of choroiditis both eye. Her personal history was normal with no addiction of smoking or alcohol. The general and systemic examination was normal. Coming to ocular examination, facial symmetry was maintained, head posture was normal. Visual acuity right eye was 612 and left eye was 660 without any improvement. Color vision right eye was 10 by 17 and left eye was also 10 by 17. IOP on Goldman applanation tonometry was 14 and 18 both eye with a normal other ocular examination. Coming to fundus examination, right eye, glow was present on distant direct ophthalmoscopy, media was clear, disc was normal in terms of size, shape, color and margins with a CD ratio of 0.4:1 and RR was healthy. Oval yellow smooth elevated lesion covering the fovea with dilated vessel was present. In the left eye, there was yellow pigmented lesions on and around the fovea resembling scrambled egg appearance with dilated vessels. On the right side, this was the appearance of the fundus. We did an autofluorescence and in the right eye there was oval area of autofluorescence and in the left eye there was peripheral ring of hyperautofluorescence. On OCT macula, there was deposition of homogeneous hyperreflective material in the retinal pigment epithelium and subretinal fluid was present. We did an FA for the patient and there was hypofluorescence secondary to block fluorescence in the area of vitelliform deposits. There was no sign of choroidal neovascular membrane. We did an electrooculogram and the Ardens ratio was 1.2 right eye and 1.3 left eye. My final diagnosis was both eye best vitelliform macular dystrophy, right eye vitelliform stage and left eye vitelliform stage. We stopped the ATT after consultation with infectious disease specialist and we reviewed the patient every 3 months to look for any CNVM changes. Thank you.
So what basis you started ATT?
So the ATT was not started by us. She basically visited someone else and they started it only on the basis of a positive MON2 test.
Okay, positive non-text is not the criteria
Yes,
you should take.
Yes sir, yes sir. That's why we stopped the ATT after.
So clinically you made the diagnosis of?
So clinically, because of the presence in the right eye, there was an elevated oval lesion and the left eye.
Thank you.
Thank you.